Okay, so wrapping up our mini lecture here, let's just talk just briefly about trauma sensitivity, ethics, and supervision. There are some people that may consider career development to be the light side of counseling, but I can tell you that you really need to expect the work to trigger memories, future anxieties, and stressors for your clients. So be prepared to fluidly integrate your career development skills and your mental health treatment processes when working with clients in the career development process, I suppose. And this would mean, very, very much addressing stress and self-management prior to delving into the complex and intensive work of career development. This can be done through psychoeducation, through Gestalt therapy, through all the different modalities that we've talked about this week. Um, be sure to assess their current level of coping and identify where some deficits may be and learn or teach, some new skills when needed. Because I'll tell you, even when doing a resume, clients can be triggered, they can get quite upset in reviewing their past. Um, and thinking about their future, the interview, and the possibility of rejection or any number of things. So it is super important to be sensitive to that, and then consider, uh, and when you start off as well, uh, you know, while doing your assessment, it may or may not come to light that there has been a history of trauma. This often does not come to light in the first couple of sessions. It takes time to build trust. And with career development, there's this tendency to sort of jump right in, which is okay. Do an assessment. It doesn't have to be ultra comprehensive, but just be aware or sort of maybe start off with the idea that everyone brings some trauma to the table and that can be triggered at any time. Um, Thinking about ethics and supervision, you want to regularly review your ethical guidelines, the guidelines related to your license type and within the context of the position that you're working, and just be super aware of the kinds of things that might arise within the context that you work. Is there a potential for a dual role? Is there a potential for duty to warn? Um, is there a potential for confidential sharing of information? So all of that's going to be super important. And I really encourage you to use supervision um, for for even the easiest, so-called easiest of clients. Many times we have very limited time for supervision, and we reserve the tough cases for our to review with our supervisor. Um, but sometimes, like for me playing guitar, I like to go back to the very basics. And that is a very good habit to consider with your supervisor. Talk about the cases that are going well. It's an opportunity for you to get terrific feedback, but it's also an opportunity to review some of the very basics that you may be taking for granted. For instance, transference, countertransference issues may come up. Um, and and by reviewing cases, you also have an opportunity to expand your knowledge of resources. You always want to have your bag of tricks, your toolbox of resources that you can call upon in a moment's notice to help support the work that you do. So have your resources cataloged either on your browser or in your favorites or in whatever way that works for you for easy reference so that when something comes up, it could be grieving, it could be um, trauma, it could be anxiety, or any number of things. Try to have some resources that you can direct clients to access or that you can access and brush up um, on the kinds of interventions that you feel good about doing. I want to thank you for bearing with me during this this presentation. It's been a little disjointed because of my tech issues, and I'll work through them as best I can. But thank you, and we'll be talking soon.